Welcome back. Here with us on Urban Debate on Mirror Now. There are about 23 cases of Omicron variant in the country already, including 10 from the state of Maharashtra itself. The case count is increasing. Worldwide as well, the cases of Omicron variant are going up every single day. Now, with the increase in the cases, the chorus is also growing for a booster shot, especially for those people who were vaccinated in the beginning, in January for India. On 16th of January, the vaccination drive started. The health workers, the COVID warriors were vaccinated first. It's been about more than 11 months already. Should now they be considered for a possible booster dose? That's the kind of debate that's currently going on. Some experts have stressed that it is time that we bring the booster dose. The new policy should be in place. And with this debate that we are seeing, there are many confusions and many questions as well. Questions like, what exactly is a booster dose? So here is our attempt to try and help you understand what exactly is a booster dose, because it is getting confused with an additional dose concept as well. So a booster dose is a shot that is given to strengthen the immune system. Now, that can be of the exact same vaccine that you've taken earlier. It works to produce more antibodies and build protection after the impact of the previous doses wanes out. Now, this is not exactly the same as the third dose. So there are too many questions that need to be answered, and that's the reason why today our focus is on the booster shot issue. Do we need booster shots or not? Now, given after the additional dose, as I was mentioning earlier, is given after one has completed the vaccine series, and protection after impact of previous doses begins to reduce. Now, that is another important issue, because many people are also asking, if somebody has taken Covaxin here in India or Covishield, both the doses of Covaxin or Covishield, then what should the third booster dose be? Can it be a dose of Covishield for the person who's taken Covaxin, and the other way around, if somebody has taken Covishield, can that booster dose be Covaxin, or there's going to be a completely different kind of a vaccine dose that will be called as booster dose? So all that we are going to discuss. As we speak, the global health body WHO Strategic Advisory Group of experts is having a meeting to discuss the evidence on the need for booster doses of COVID-19 vaccines and also recommendations for the same. A meet that is very significant at this point in time because, one, there is a significant rise in Omicron cases, and developed countries specifically who are moving very fast in their vaccination drive are asking for this need to have a booster dose. And then immunizing vulnerable population. That's another cause of concern that the experts have right now. And even Maharashtra Minister Aditya Thackeray has made 3-point requests to the centre. Request number 1. Third dose should be given to health workers. Request number 2, the vaccination minimum age should be reduced now to 15, which is currently 18. Remember, for children, the vaccination drive hasn't begun in India yet. And third request is that the gap between two jabs should be reduced to 4 weeks now. So tonight we ask, is it time now to introduce the booster policy? Is booster dose same as the third dose? And should India first vaccinate all or give priority to booster shots? And will booster shots really help in fighting the new variant of concern right now? That's our big debate. And just like yesterday, tonight as well, the phone lines are open for you, because we don't want it to be a one-way communication. I want my viewers to also participate. It's a very, very important subject that we are taking up today. And the numbers are there on your screens right now. You can call us in case you have any questions. An eminent panel of experts, in fact, is now joining us on the broadcast too. Dr. Rajiv Dasgupta, Chairperson, Center of Social Medicine and Community Health, JNU, and member of National COVID Task Force. We will be joined by Dr. Shashank Joshi in just a bit. He's consultant endocrinologist, Leelavati Hospital, and is also member COVID-19 Task Force. We have Dr. Vishal Rao, Dean, Center for Academic Research, HCG Cancer Center, and member of Genomic Surveillance Committee, COVID Task Force. We are also joined by Dr. Subhash Salunke, Senior Advisor, Public Health Foundation of India, Delhi, and member of COVID-19 Task Force, Maharashtra. And lastly, Dr. Anita Ramesh, who is Clinical Trial Specialist and Senior Consultant, Apollo, Chennai. Good evening to all of you. Now, Dr. Anita Ramesh, let me begin this discussion with you. Simple question I want to ask you. Do we need booster shots?
Okay, just a single answer to this, I will say yes. Yes, we do need, because there is a study which has already demonstrated, and if you see the two running vaccines in India, one is the Covishield and the other is Covaxin. The Covishield has 85 and 63% efficacy against the symptomatic and the severely infected, whereas Covaxin has 50% efficacy. And as we know, there is a dwindling innate immunity in our body. And over a period, like I have taken my second dose early February, middle of February, after 1 month. So I'm almost 11 minus 2, 9 months down the lane. I'm sure my immunity has dwindled over a period of time. So there is a definitely need for booster dose. Not only there is scientific evidence behind it saying that the immunity wanes off, and this is not the only disease. And as you know, hepatitis, there are several other diseases. Even the childhood immunization program against the viruses does have booster dose after 2 years, 5 years accordingly. So there is already evidence. There is already clinical scientific evidence showing that the immunity is decreased, and all the more with the emergence of the new variant. Yes, we don't have the complete answer that whether it will be able to control the new variant, but definitely some sort of protection will be given by the booster dose to step up our immunity to fight with the new strain as on today.
Okay.
So one answer, yes, we all need the booster dose, particularly healthcare professionals, which includes everybody, starting from front desks, security, paramedics, nurses, everybody. I'm a cancer specialist, so I need for all my immunocompromised and those with high-risk features, all elderly individual, and also I add the children, particularly like how you said 15 years, and that's a good age because 9, 10, 11, 12 class are going to school and board exam. So that's the age, again, a priority.
Okay, so you believe that there is a need to have booster shots now. Dr. Rajiv Dasgupta, what is your point of view and what is the government really thinking in this regard?
Well, as far as the government's thinking goes, that will be articulated by bodies, advisory bodies such as NTAGI and NECVAC. As far as the global evidence goes, Omicron certainly is spreading rapidly. In UK, the doubling time is about 3 days. The test positivity rate in South Africa continues to be above 25%. 5% is the cutoff for a warning signal, and above 10% is certainly red. So these are indications as to how rapidly Omicron can spread. Can Omicron replace Delta as the dominant? We don't know yet. That's something to watch out for, but it will certainly take time. Has any death been reported from Omicron? Not yet. In almost 50 countries across the world where Omicron has already been reported. Now, in principle, these vaccines require a booster. In principle, a heterologous booster vaccine, which means a booster by another vaccine, not the one you took as the primary, is expected to or is anticipated to produce greater immunity compared to using the same vaccine. But the choice of vaccine and this entire decision as to when to launch to a booster, these are national decisions which are based on a whole range of programmatic considerations, and therefore those decisions are a lot more pragmatic beyond what science informs us.
In your personal opinion, as a doctor, do you think we need to have this policy out very soon, given the current situation?
The policy certainly needs to be spelled out very soon, and we can expect that these advisory bodies are working overtime to frame this policy. But then, as you described at the beginning of the program, the additional dose is of far greater urgency than the booster dose. And that includes not just adults with immune suppressed conditions, but children and adolescents too, who are more vulnerable than the immune competent children.
Okay. Dr. Subhash Saluke, what is your opinion? Where do you stand on the issue of booster shots?
I think both Anita and Rajiv have clearly indicated there is a need, absolutely. And the point that you have made that the policy decision need to be done not tomorrow, today or yesterday, because the fact remains there is a window of opportunity as far as we are concerned. Globally, still this particular variant seems to be higher transmissibility but lower virulence. Now, if this happens, that it continues to have a lower virulence, we are in a comparatively safer position. But if the virulence goes up, then we are going to have a very serious kind of repercussions with the critical cases. The deaths might go up and there is going to be much more panic. Right now, if we ensure that the booster dose or the third dose, whatever you can say, needs to be considered particularly for the section of the society which are in the high risk, and both Rajiv and Anita have already indicated who are they. So we know who need to be protected more. We also know that we have adequate quantity of the doses available. Certainly, we will require to use a balanced approach that children below the age of 18, between 12 to 18, also need to be covered on priority, and the frontline workers, the people who are having immunocompromised status, cancer patients, HIV patients, they need to be protected. So strategically, Government of India need to give this kind of freedom to the state governments, and they should try and work it out. Last 8 months have proved beyond doubt that the health systems are very responsive, and we could, state governments will be able to really carry out these functions smoothly because we are now used to it. So there is definitely a need, and we should try and do it ASAP. No, we don't have to do too much of science into it. We need to ensure confidence in people too. We need to ensure that the people do not become severely ill or critically ill and they do not die. That is the most critical part.
Okay. Dr. Vishal Rao, what is your opinion? Do we now need booster shots immediately?
I think if you look at consensus that is coming out globally from the scientific literature, whether it's from UK, the USA, Europe, and I think the trailblazer, the Israel, which published the data of almost 10 lakh patients from which was published in Lancet, all clearly pointing out to one single fact: a booster dose helps. Now, at this juncture, when we are talking about naturally a global vaccine inequality, there is this debate of 3 for me and none for you. So that's something that WHO, I think at a larger level, is trying to look at putting a moratorium on third doses as a generic approach. But the one thing unanimously globally countries are acknowledging is that frontline workers with high risk are the ones who should be getting the third dose at the earliest. And immunologists, eminent immunologists world over have acknowledged the fact that a booster dose helps give your immune system a reminder that the war is still far from over and activates your T memory cells.
Okay, but Dr. Rajiv Dasgupta, then I want to ask you another question about the issue of vaccine inequality that Dr. Vishal Rao also mentioned. Should the focus right now be on using the vaccine doses that are available with us to vaccinate those who are still unvaccinated, who we are yet to vaccinate? Because only 50%, if I'm not wrong, have managed to get both the doses. Many, of course, are still unvaccinated. Should the focus be there, or should the focus now be on giving the third dose or the booster dose?
Well, in the ideal world, it's not an either-or scenario. Those who have received 2 doses, given a certain interval of 6 months plus, they are in need of a third dose. At the same time, coverage of the entire eligible population with 2 doses is also a commitment and it's also a necessity. The point is, today I'll draw your attention to 2 media reports uploaded perhaps in the last 6 hours or so. One saying that 11 crore vaccine doses are still lying unutilized or underutilized with 5 large states. That is the extent of complacency particularly regarding the second dose, given a very comfortable stage of less than 10,000 new cases per day. And the other news item is that the Serum Institute of India has decided to cut its production by 50% of its capacity, given that it's got no additional orders. Now, supply orders. Now, this is therefore a combination of multiple strands of facts and issues within the country. And add to that the national government's commitment to the WHO's Covax initiative, which aims to support nearly 100 countries who do not have the luxury of domestic production that we have. So as far as the Indian government goes, it really has to balance a multitude of factors, and that's not really an easy decision, either scientifically or politically.
Okay. Stay on with us, Dr. Rajiv Dasgupta. In fact, some viewers have also started calling us on the broadcast. We have Dr. Patnaik from Hyderabad joining us this evening. Thank you very much for calling us here on Mirror Now. What is it that you would like to ask?
Yeah, I'm Dr. Patnaik from Hyderabad. Basically, you see, I also work for a healthcare system here. I've been watching, that more than 40% of the vaccines are not being used in the recent months. The vaccine intake has come down. And with a lot of debate going on about booster dose and the third booster dose, especially the frontline workers should be given the first priority. Why not government take a quick initiative to reduce the vaccine wastage and then not being put to use? Hope I'm clear.
Yes. Important point that you're making, Dr. Patnaik. Appreciate you calling us here on Mirror Now. Vaccine wastage, of course, is a big cause of concern, and Dr. Rajiv Dasgupta also gave us some very interesting data. We have another viewer joining us, Colonel Nagrat from Noida. Good evening, Colonel Nagrat. What is it that you would like to ask?
I have a simple question to the panelists. The people who had taken 2 doses and after a gap of 6 months and have gone in for a testing, there's your antibody value on that, and if the antibody value is say around 150 plus, are they not the safe from this new COVID variant, or they should still go for a booster irrespective of what value one has? I think there should be some yardstick to know how much immunity you have, and antibody does show that he has a sufficient immunity. So why should we be told to go for a third dose?
Okay. Thank you very much, Colonel Nagrat, for joining us here on Mirror Now. Dr. Anita Ramesh, would you like to respond to that?
Yes, it's a very important question, saying that to measure your antibodies in the blood, yes, till now it is not recommended. But we have done on certain cases in hospitals with admissions with COVID. Yes, it was seen that the antibody level does come down. But then we do not have it's a CAP accredited labs to do an antibody. And I think in the time of the pandemic, whether we need to overload our labs by recording the antibody testing rather than detecting the Omicron new variant will become a big issue. We need to also gear up our sources so that all these who have vaccinated with 1.26 billion, whether we need to do an antibody test, I think it will become a little difficult at this point of time. And we have heard the other panelists, there's scientific evidence with dwindling of innate immunity. Even your antibodies may be present, but they may not be active against the infection. So in such a pandemic scenario, it is not the ideal time to do an antibody test, but rather just go on with. And my feeling is that you have to go on to the vaccination simultaneously. Let's India complete the single and double dose. You know, door-to-door vaccination has increased, 11% increase. Wastage is coming down, and parallelly, simultaneously start the healthcare workers and the immunocompromised and children. Everything should run parallelly. Yes, your point is pertinent as far as science is concerned, but I think it is little difficult at this point to do antibody and the report to come and then call them back. Okay, I am not sure at this point of time, might not, maybe later on can be a valid option to be done.
Okay. Dr. Subhash Saluke, now another point that we also need to focus on is if there is any kind of scientific evidence to tell us actually the immunity is actually reducing after a certain number of months. What can we really rely on?
As a matter of fact, as has been clearly indicated, that the antibody titer testing is really not very relevant. So let us forget about that. The fact remains that every vaccine that has been taken initially with one dose and then followed by a booster dose, that booster dose itself is essential because there is definitely a decline in the antibody response of the body. And that's the reason it needs to be stimulated, and hence the booster dose. And now we are talking about the third dose also. So facts are, yes, the immunity response that we get after the first dose goes up, and then there is a decline, and that need to be accelerated with the booster dose. And that is precisely the reason that at least at this juncture in India, we have vaccines which do require minimum 2 doses to sustain the antibody level. And the fact remains that single dose doesn't give you adequate protection. Double dose or the second dose, which is as per the duration, depending upon whether you are taking Covaxin or Covishield, and then there is definitely a protection level which is assured. However, it is expected within 8 to 9 months or maximum 1 year, there is bound to be decline, and that is why we are discussing this third dose. So this is what is based upon the science.
Okay, Dr. Vishal Rao, now, then again the question is, because the kind of cases that we have seen coming from South Africa specifically of Omicron variant, it is largely impacting those who are unvaccinated. And that's precisely the reason why I asked that question, that whether the focus right now should be on, giving vaccine doses to those who probably got it in the beginning, the frontline workers, or those who are still vulnerable, or maybe children, as Maharashtra's Minister Aditya Thackeray today has also had made a request to the centre that the minimum age should be, now changed from 18 to 15. And that's the age group which is also vulnerable.
So, Heena, the data that has recently come out from South Africa shows some very interesting trends. If you see 1 week before Omicron, it was at about 280 cases per day, and today it has reached almost 16,000 cases per day. What's most relevant at this juncture is that the data that has come out yesterday from the Stellenbosch University, their epidemiological group, shows that they had substantial number of patients who had reinfection. And these are patients who had been infected with Delta who have had reinfections. Now, looking at some of these data and the conclusions that they've done from real world evidence, they are inclined to say that somehow, if you look at this, the seroprevalence could be a false hope for us to be relying on too much. And this is important for all of us to know that the concept of herd immunity or the concept of seroprevalence may not be sacrosanct, and every wave could be having a signature caused by a new variant which may ask for a new herd. So it's very, very important for us to cautiously interpret these data about immunity. And at this juncture, I think the most I would say diligent step would be to focus on vaccination. Like today, South Africa, surrounding countries who are also grappling, like Nigeria has only got 3% odd vaccination. So we will need to address the surrounding groups around Africa, which also potentially in the future could be emerging a new wave, a new variant.
Okay, that is very important, and this is something that we all need to be concerned about as well. From 280 cases, as you told us a week ago, to about 16,000 cases that South Africa is now reporting, and that's the reason why there is this concern, there's this bit of worry that is there in the country too. We have another viewer, in fact, joining us on the broadcast, Sanjeev from Indore. Good evening, Mr. Sanjeev. Thank you for calling us here on Mirror Now. What is it that you will like to ask?
Yeah. So first of all, at the outset, ma'am, good evening to all the panelists and to you.
Good evening.
The fact of the matter is that the Omicron, please give me 1.5 minutes, ma'am, because it is very essential. So the fact of the matter is, in the initial reports, Omicron doesn't give any fatality or leads to the hospitalization. That is correct. But the fact of the matter is, during the Delta, if you could see, the infection rate has increased. And the fact of the matter is, whenever the transmissibility is more, the virus mutates further, and Delta was created or got mutated in India because there was a large number of infections. So even the chances are very, very high, although the present Omicron may not be deadly or may not lead to the hospitalization, but once if it touches to the India and the transmission rate goes up, although it may be asymptomatic, but there are very, very prominent chances that it may get mutated to some other new variant which may be deadly. So the fact is, and the one thing which respected one panelist has said, it is really very bizarre for Indian government. I'm sorry, I'm not against anybody. The fact is, Serum has reduced the production by 50% when the whole world is dying for the vaccine. I mean, the booster shots, if government cannot, one thing last I want to say, even if what I feel Dr. N.K. Arora Sahab is very reluctant to give, there is no, I mean, what the Indian doctors or the panelists want to say. All these Western countries, all the developed countries are idiots that they are administrating the booster dose. No, definitely it adds to the value of the immunity.
We've taken your point. Thank you very much for calling us here on Mirror Now. Dr. Rajiv Dasgupta. Now, we've been discussing about this issue of booster dose for quite some time now, and why there is anxiety because Omicron cases are also going up. Why is the government taking so much of time to come out with a policy at least? Even if we are waiting for WHO's stand on this particular matter, the meeting is happening as we speak. Why can't the government at least be prepared with a policy?
Well, the anxiety and the question is justified to the extent that many countries have certainly come up with a booster policy. In the US, for example, CDC's policy is a booster dose depending on 2 months or 6 months after whichever vaccine you took for those specific vaccines. So many countries have certainly already framed booster policies. The Indian advisory groups, it's not that they're not working on the issue. They are certainly working on the issue. Now, how soon they're going to come out with a stated policy, I can't answer that. I mean, for the simple reason I don't know. Of course, all of us are awaiting a policy position on this. But at the same time, on the other hand, while Omicron is certainly multiplying rapidly, whether this will replace Delta, whether it will lead to emergence of other mutant forms and so on, those are unknown entities. Even prior to Delta, for example, some of the beta variants were multiplying rapidly in India. And at any point of time, anything between half a dozen to a dozen variants may actually be present at the population level.
Right.
It is only that some establish itself as a dominant one. So we are fraught with a lot of uncertainties, but that does not take away attention from the fact that there needs to be a stated booster policy or an additional dose policy, whatever the wisdom may be.
Okay. Stay on with us, Dr. Rajiv Dasgupta. Another viewer, in fact, joining us on the broadcast this evening, Christopher Rodrigues from Mumbai. Good evening. What is it that you would like to ask?
I wanted to find out actually, where is the study that says that this vaccine that we have work on this new virus, new mutant, whatever you call it? If you're going to give us a booster, that booster must work on this new variant. Then only it is useful. Otherwise, why are we talking about booster when we don't have the study? No one says that the study has been done and says that this vaccine works.
All right, that's a very important point that you're raising. Appreciate you calling us here on Mirror Now, and I would like Dr. Subhash Salunke to address this concern. Like I was asking earlier as well, is there any scientific evidence right now that we can use to say that we need booster shots like that? Is there any scientific evidence with us to show that the booster dose is going to work against the Omicron variant?
Well, I think, friends, please understand that this new variant has come just fortnight back only to the forefront, whether it's South Africa or Europe or
Then,
India.
sir, why is this
Now,
debate around the booster policy at all? Why are we giving it too much of attention then?
I'm trying to make a point that even when Delta came, the same vaccine protected us. The vaccine development, when it took place, Delta variant was not there. Please understand, this virus which we are battling with has these are the variants. It's not totally different virus, and that is the precise reason that the vaccines which are being used throughout the globe and particularly within India are assured to give some protection. It can't be 100% protection, but in spite of the newer variants, the existing vaccines, both Covishield and Covaxin, is going to offer protection. That's why the third dose. Now, this kind of a study and scientific evidence, etc., is going to be prospective one. But from the epidemiological perspective, I confidently tell you that the existing vaccines are offering protections, both earlier variants and likely also the present variant, even if there is a slight change, but still the offering of this vaccine protection is definitely there.
Okay. Dr. Vishal Rao, in your opinion, what should our booster policy in that case look like? Because we know that the government is waiting for some kind of evidence, we can say some kind of a direction from the WHO as well in this regard. It is still in a wait and watch mode. Yesterday, there was an important meeting that took place on the issue of booster dose. There was nothing specific that came out. But in your opinion, what should it really look like? We need to be prepared.
So I think if you look at the current real world data, there's enough of mounting evidence repeatedly pointing us in the direction that booster dose help. Now the question is, how do you build the overall justification for bridging the inequality gaps within the country while delivering more of the second doses, at the same time prioritizing the third dose for the frontline workers? So I think at this juncture, it would be most prudent if you could consider the third booster dose for frontline workers, and at the same time put the best efforts towards penetrating the campaigns deeper into the corners of the country where we are able to educate people, help them overcome the hesitancy and complete the second dose. Now, I think I just want to add one more quick point in this, that today with the data from Omicron, what we know is higher transmission, immune escape, and possible vaccine reduced efficacy. The aspect of higher virulence has still not been proven. But if you look at the data coming out from scientific experts from Lancet, Nature, or the Science, are saying that this could be anecdotal, because as this number touches thousands, lakhs, this entire biological behavior may change. So it would be very anecdotal for us to say this is just mild symptoms now when it has almost touched 40 countries. So I think it's very important to keep a priority on booster doses, and especially for frontline workers as a priority right now.
Okay. Well, that's something that the IMA has also demanded for the frontline workers, for the health workers specifically who were vaccinated during the month of January or in the beginning, the first phase of vaccination drive. They should be now given the booster dose. We have another viewer, in fact, joining us on the broadcast, of Ravi from Bengaluru. Good evening, Ravi. What is it that you would like to ask?
Good evening, ma'am, and to all our panelists. I would like to ask all our panelists, why is it that despite the vaccines being so safe, they're still on the emergency use approval?
Okay. Ravi, appreciate you calling us here on Times Now. Dr. Rajiv Dasgupta, will you like to take that?
Well, that's part of the current state of approvals, because a large number of vaccines for various users, including adult, including children, etc., those are being authorized very rapidly, whether it's at the national level or it's at the international level by the WHO. That's not really a matter of concern. By concern, I mean from the vaccine recipient's perspective, because there are a limited number of vaccines which are being used globally. All national regulators are watching it, tracking it, particularly with respect to both the protection that it's offering as well as adverse events that may be happening.
And I would now like to take the closing comments from my other guests as well, because of course you all have suggested that there is a need to have a booster policy, especially for the frontline workers, but we'll have to see what the government eventually is going to do about it. We are being told that the decision of the World Health Organization will be coming out tomorrow, and earlier we were being told that the press conference was to happen tonight, but that has now been postponed to tomorrow. Dr. Anita Ramesh, your closing comments, and how should the booster policy of the country really look like, in your opinion, with the kind of demands that are being made?
Yes, with the booster, definitely, I would also agree with everybody. Booster is needed, and I'm sure WHO and the press conference will come up with a positive answer. You know, this is going on, but the last 2 weeks, the talks have aggravated with the Omicron rising. Another point to that is that, remember, the Covaxin and particularly Covaxin is made from an inactivated entire viron. So that, and basically we know it's the same coronavirus with just 26 to 32 mutations different. So definitely this particular vaccine will give us some sort of immunity, and 100% immunity no vaccine can give you. So all the viewers, don't let your guards down. 2 meters of distance, double 2 plies of masks, 2 doses of vaccine is all that you need at this point of time. And we need to be with the government, and all of us have to come together to fight this virus out.
Right. And we are also now joined by Dr. Shashank Joshi, consultant endocrinologist, Leelavati Hospital, and member COVID-19 task force in Maharashtra. Sir, thank you very much for joining us. Though we're just about to close the debate, but I want your comments on this very, very important issue that we are discussing, the need for booster shots. Should we consider vaccinating the population which is still unvaccinated, which we are aiming to vaccinate, or now look at vaccinating or giving booster dose to the frontline workers who were vaccinated during the first phase? Your opinion, sir.
So there are two parts to this. One is the public health perspective. Most of the people, most of the time, as early, as quickly to people who have not got a single dose and second dose. That should be done. But simultaneously, if supply is not an issue, and I'm given to understand supply is not an issue, a small segment of population which is recurrently exposed to the virus, like frontline or healthcare, or a small population which is not mounting a sufficient immune response, like moderate to severely immunocompromised individuals, also merit a vaccination. And I think that is something which is also the need of the hour, and that domain and the numbers come to around 3 or 4 crores only. So I think when we are already reached 85% of our population with the first dose, and 50% of the population, WHO cut point for 2 doses was 40%. We have already crossed that threshold, and there is sufficient science to show that people who have got the first and second shot in January and February, now more than almost 9, 10 or 11 months have passed. I think protecting people who are going to be recurrently exposed to the current Delta, the current threat of Omicron, though it may be very, very minor and sporadic, they definitely need some degree of protection. We only need to see 2 things. Number one, see what is the Indian evidence which has been generated in that direction. That is not in public domain, and the experts need to look at that very cautiously and carefully. Number 2, WHO is very clear as far as moderate to severe immunocompromised state is concerned, an additional dose is needed. So I think the additional dose, as well as for the people who have the recurrent exposure in a COVID environment where they are working, whether they are frontline or healthcare, definitely need an additional dose. And if supply, we are the vaccine pharmacy of the world. We are now committed to our COVAX program. We have a company like Serum Institute saying that they are not getting sufficient orders, but they have capability to produce more vaccines. When we have that issue in challenge, there is no harm doing both these things simultaneously. And that is what is my answer to this whole thing.
But sir, then why is the government not coming out with the booster policy? Decision of the World Health Organization is awaited, but then yesterday there was an important meeting as well. Why can't we be ready with a policy, and as soon as we are prepared to begin the rollout of this booster shot, especially for the people who need it the most right now, the most vulnerable group, as you just described for our viewers, we can start rolling it out. Why this wait and watch mode?
So maybe they are waiting for Indian evidence. They are basing it on a hypothesis that a large population was already exposed, and therefore if you have had 2 shots and you had COVID, then it is as good as hybrid immunity. But that's a subset of the population. And even in that subset of the population, now 6 months have passed. So antibody levels will decline, T-cell immunity also will decline. So obviously we need to be mindful of that fact. Secondly, WHO almost 4 months back on their website has clearly said that as far as moderate to severe immunocompromised states are concerned, or any human being who has an underlying condition which fails to mount an immune response, B or C T cells, should be eligible to get an additional dose. So I don't see there is major depth, but probably they are waiting for some scientific evidence for it to come, and they are committed to equanimity and equality in a big way.
And Dr. Joshi, one last thing that I want to seek your opinion on is a request, in fact, that has gone from Maharashtra Minister Aditya Thackeray to the centre today, in which he said that the minimum vaccination age should be reduced to 15. Your opinion on this?
So that is based on the data that many children are in the 10th and 12th standard, and they are of the school going age. So those 5 crucial years when they are in their school going age and the schools are open, examinations are going on, they need protection. So if you are going to do a calibrated approach to pediatric vaccinations, that's the way to start about it. Ideally, one would like to vaccinate everybody on planet Earth. That is the ideal way. But some process has to be followed. So in that process, he has in his wisdom felt that if there is people between 15 to 18 are taken on a priority of the pecking order, probably that population is the one which is exam going population. The 2 crucial exams and filters in India are the 10th and the 12th grade exams, and they would be protected, and they are all exam going students. So probably that was in his mind when he must have written that letter.
All right, Dr. Shashank Joshi, Dr. Anita Ramesh, Dr. Rajiv Dasgupta, Dr. Subhash Salunke and Dr. Vishal Rao. I appreciate all of you for joining us here on this debate on Mirror Now, and we really hope that our viewers also got the answers that they were looking for on this entire issue around booster shot. We'll see eventually what the centre decides, but all eyes are going to be on WHO's big statement tomorrow. Heading into a short break, more updates on the other side. Don't go anywhere.